We are discussing about medicine section. Yes, sir. No?
Yes, sir.
Okay. We completed psychiatry. Psychiatry.
Yes, sir.
Okay. Next, make heading dialysis. Dialysis. Right. Dialysis is of two types. Dialysis is of two types. First one, hemodialysis. Second one, peritoneal dialysis. Hemodialysis, peritoneal dialysis. Dialysis is of two types. First one, hemodialysis. Second one, peritoneal dialysis. First one, right? Hemodialysis. Key terms are hemodialysis. Key terms are creation of AV graft. AV means arteriovenous graft. Creation of AV graft. For peritoneal dialysis, for peritoneal dialysis, for peritoneal dialysis, physician documents, physician documents other than AV graft. Physician documents other than AV graft. Other than AV graft. Now you can see the quotes here in your book, textbook. 90935. Are you there, everyone? 90935. 90935.
Yes, sir.
Yes, sir.
You can see the quote single evaluation. In a day, one time evaluated the dialysis patient. 90937 repeated. That means more than one time. In a day, more than one time. If you note, you can note down this. Third code, if you see, blood flow in AV graft. Blood flow in AV graft. Next one, As I said, other than hemodialysis is peritoneal dialysis. See the code 90945. Dialysis procedures other than hemodialysis. 90947 repeated evaluations. Repeated evaluation. When you are finding hemodialysis or peritoneal dialysis, what we need to look for? Single evaluation or repeated evaluation? See the question 43. Question number 43. 43. What is the answer? 43. What type of dialysis performed by the physician?
Peritoneal dialysis.
Peritoneal dialysis. How many evaluations done?
Second evaluation, sir.
Single evaluation or repeated evaluations on the same day?
Repeated evaluations.
Repeated evaluation.
No,
Where?
no, sir. Single evaluation only.
Single evaluation. Then what is the code?
90945.
90945. This is the way you need to see. Dual time means not repeated evaluations. The physician clearly have to mention repeatedly a physician is evaluating the patient before dialysis. Single evaluation means one time. Repeated evaluations, they will clearly document in the question so that you can capture 90947. Here the answer is 90945. Based on ICD, the answer is C. What is the answer? C. Understood everyone? Now, try to see question number 44. 44. It's a straightforward question. 44. What is the answer?
Double 9503.
99503. Yes or no? Okay.
Yes, sir.
Next one. ESRD services. ESRD services. ESRD services. Write down the codes. ESRD services codes are based on first point age. Second point physician providing services at home. Physician providing services at home or physician office. Services at home or physician office. Physician providing services at home or physician office. Next one. At office. At office. Codes are based on. At office. Codes are based on number of face-to-face visits. At office, codes are based on number of face-to-face visits per month. At office, codes are based on number of face-to-face visits per month. Codes are based on number of face-to-face visits per month. Next point. At home. At home, codes are based on. At home, codes are based on per month. At home, codes are based on per month or per day. At home, codes are based on per month or per day. At home, codes are based on per month or per day. Now try to check the codes. 90951, 90951, 90951. ESRD related services monthly for patients younger than 2 years of age to include monitoring for the adequacy of nutrition, assessment of growth and development, and counseling of parents with 4 or more face-to-face visits by a physician. Yes, sir. We can see per month. First you need to look for the age. Next you need to look for where is the service performed. It is performed at physician office. how many face-to-face visits he is providing? 4 or more. If you see the next code 90952, 223 face-to-face visits per month. Like that, the codes are. Next one you can use. You can see the codes 90963, 90963. ESRD related services for dialysis per full month for patients younger than 2 years of age. The dialysis services are providing at home. The age is 2 years or younger than 2 years per month. If you see the codes 90967, 90967, ESRD related service for dialysis less than a full month of service per day. We need to quote per day for patients younger than 2 years of age. Now take one question and give me the answer. A 55 years old patient, a 55 years old patient is at home. ESRD services done by a physician for 5 days. ESRD services done by a physician for 5 days. Option A 90966, 90966. Option B 90970, 90970. Option C 90970 into 5 times, 90970 into 5 times. Option D 90960, 90960. Try to give me the answer.
Sir, 90960. AI also tell.
Any other answers? Any other answer? Text me your answers so that I will see. Dimple, why you selected a D option? What is the D? 90?
90960, sir.
90?
960.
Can you read the code description 90960?
End stage renal disease related service monthly for patient year and 20 year of age and older with 4 or more face-to-face visit by a physician or other qualified healthcare profession per month.
Okay, now can you read what are the rules I said?
55-year-old patient at home and 5-day physician's meeting. And 960, they are saying 4 or more than 4 face-to-face visit.
No. What are the rules I said? First, what do we need to look for when we are doing ESR related question?
First, age.
Age. What is the age?
Home visit.
In the given question, what is the age?
55 years.
55. Next.
55 years.
Okay. Next, what is the next point we need to look for?
At home.
The services provided home are
And
yes or no?
yes, sir. Yes, sir.
Where are these services provided in the given question?
Yes, sir.
Where is this service provided? At home?
At home, sir.
Okay. Third point.
At home, sir.
Okay. Next point, what we need to look for?
By physician 5 days visit.
That means it is not a service provided in the physician office, and the code is not based on number of face-to-face visits. Yes or no? Physician is attending the patient
Yes,
for
sir.
5 days. How many days? 5 days. Now try to see the code
5
description.
days.
Try to see the code description, everyone. 90967 ESRD related services for dialysis less than a full month. This is not a full month service, only 5 days in a month. Less than a full month of service per day, age for patients 20 years or older. That means what is your answer? 90970 into 5 times. Sunil, why you quoted 90966? It is a full month service or 5 days in a month? It is a
5
service.
days a month, sir.
5
But
days a month,
because
not a
I
full month service.
home service never.
90967 is also home based services only. If you want to just note down there.
But he had not mentioned, that's why I used, sir.
It's not a full month. You need to look for where is the service provided. It's a full month service or not. If it is not a full month service,
No, sir.
9096. What is the answer? 90970 into 5 times. Take one more question.
Okay.
A patient 40 years of age. A patient with 40 years of age. Physician provided 3 face-to-face visits in physician office in a month. Physician provided 3 face-to-face visits in a month in his office. Option A 90970. Option B 90966. 90966. Option C 90961. 90961. Option D 90955. 90955. 90961 is the answer, everyone. 90961. Any other answers? Understood the concept, everyone? Here, per month service, number of face-to-face visits you need to look for, and the age all comes under 90961. Okay. Next, come to the codes. Mark the codes in your exam in your textbook. 91034. 91034. Try to underline in the code description nasal pH electrode. 91034. The test. How they are performing nasal catheter, that means through nose pH electrode. 91035. Underline the key term mucosal attached pH electrode. The test, but how they are performing mucosal attached pH electrode. Mucosal attached pH electrode. Next one, 91037. Intraluminal impedance electrode. Intraluminal impedance electrode. Nine one zero three eight. Greater than 1 year up to 24 hours. Those are the four key terms you need to look for. One is nasal, one is mucosal, one is intraluminal. Question number 48. 48. Completed? Completed, everyone? What is your answers?
91035, sir.
91034 or 35?
35.
35. Is it mucosal attached? Okay. 91035. Oh, let me check your answer. Dimple, why you coded C? 91037.
For gastroesophageal reflux test,
Huh? What is the electrode attached? Mucosal or intraluminal?
attach
Mucosal, right?
mucosal.
Then
Yes.
mucosal comes under which description?
035
Okay.
91035.
Now understood?
Yes, sir.
Next one. Go for ophthalmology. See the codes, everyone here. 92002. Try to see in your books. 92002, 92004, 92002, 92004, 92012, 92014. 92012, 92014. These are ophthalmology services. You can see new patient or established patient, intermediate or comprehensive. For this intermediate or comprehensive, try to mark the paragraph in page number 713. Page number 713. Under intermediate, you can see the first paragraph. For example, A is there. First paragraph, you can see this is the paragraph. In that, iritis, any inflammatory condition of a disease comes under intermediate. Iritis. Try to underline that paragraph. You can see in the same page, comprehensive examination services. You can see, for example, is there disease conditions, glaucoma, cataract, retinal disease. These are all comes under comprehensive. If any disease condition they are evaluating, you can say it as comprehensive. Iritis, inflammatory conditions they are documenting, you can say it as intermediate. This is nothing but glaucoma, cataract and everything. Okay. Can you see question number 33? 33. First point, new patient or established patient in this question. New patient or established patient?
Established patient.
Established patient. It is intermediate examination or comprehensive examination. What is the condition they are treating? Iritis. Yes or no?
Intermediate.
Intermediate. Then what will be your answer? 92012. If you want, you can see there are some included services also. If you see the code descriptions there itself in that example, below example is there. Review of internal history, external examination, ophthalmoscopy, biomicroscopy, and tonometry in established patient with known cataract or not. These are all services included. Next one, PTCA. Next concept, PTCA. Percutaneous transluminal coronary angioplasty. PTCA. Write down. First one, go for page number 725. 725. Page number 725. See the paragraph, major coronary arteries. Major coronary arteries. Major coronary arteries. Are you there, everyone? Can you see there are 5 major coronary arteries? Underline that one in your book, in your textbook. What are the major coronary arteries? Left main, left anterior descending, left circumflex, right circumflex, ramus intermedius. These are the 5 major coronary arteries. Next, can you see branches? Coronary artery branches. What are the branches here? Left anterior descending, what is the branch name? Diagonal. Left circumflex, what is the branch name? Marginal. Right circumflex, what is the branch name? Posterior descending, posterior-lateral. Are you able to underline that all those points in your book? First, you need to look for it's a major coronary artery or branch. What is documented in the question? Now write down the rules. PTCA codes. PTCA codes are based on. PTCA codes are based on. First one, angioplasty. Angioplasty. Second one, atherectomy with angioplasty. First one, angioplasty. Second one, atherectomy with angioplasty. Atherectomy with angioplasty. Third one, angioplasty with stent. Angioplasty with stent. angioplasty with stent. Fourth one, atherectomy, angioplasty with stent. Atherectomy, angioplasty with stent. Atherectomy, angioplasty with stent. What are the four terms here? Angioplasty, angioplasty with stent, atherectomy, angioplasty with stent. These are the four key terms we need to look for. Now try to see everyone the code, page number 726, 92920, 92920, 92920. What is the procedure performed by the physician there in the code description? 92920.
Percutaneous transluminal coronary angioplasty.
Single major coronary artery or branch. What is the procedure performed here? Angioplasty. Can you read the code description 92921? 92921.
Percutaneous transluminal coronary angioplasty, each additional branch of a major coronary artery.
That means the add-on code is used only for branches. The primary code is used for major coronary artery or a branch. Now, can you see the code description 92924? 92924.
Percutaneous transluminal coronary atherectomy with coronary angioplasty with performed single major or coronary artery or branch.
Now, what is the procedure performed by the physician here? Atherectomy with angioplasty. Atherectomy with angioplasty. 92928. Angioplasty with stents. Like that we need to look for. I can see the question. Question number 7. 7. Yes, Shobha, what's your answer?
92920.
92920. You can read the question, Shobha.
A patient with coronary atherosclerosis underwent PTCA in left anterior descending and the first diagonal of the LD
What does it
with
mean?
CPT.
It is formed in a major coronary artery and its branch. Yes or no?
Yes, sir, major coronary artery
And its
and
branch.
branch also.
Then why you called only one? I have shown on the first of paragraph what are major coronary arteries, what are branches. You need to look for. B is the correct answer. Everyone in the class. Any questions?
Sir, the
Yes.
left anterior descending only it is saying diagonal now, sir. So it is only one
Left
code it will become.
anterior descending is a major
Artery.
coronary artery. Diagonal.
It is artery and branch also diagonal, same.
See that paragraph, Shobha. Page number 725. Can you see? What is the branch name of left anterior descending? Diagonal. Yes or no?
Yes, sir.
Here they have performed the procedure in left anterior descending and diagonal. That means and its branch. In a major coronary artery and its branch they have performed. Now you can see the code descriptions. 92920 is for major coronary artery. 92921 is for branch. Got it?
Yes, sir.
Now take one more question, everyone. Physician performed atherectomy with angioplasty. Physician performed atherectomy with angioplasty in two major coronary arteries. Atherectomy with angioplasty in two major coronary arteries. If completed, you can tell me the answers. Text me your answers. What are the codes? Atherectomy, angioplasty.
92924.
92924. Then how many major?
92925.
See, 92924 into 2 times. How many times? 92924 into 2 times. Why? Because 92925 is used for branches, not for major coronary arteries. You can see the code description. Each additional branch of a major coronary artery. Yes or no? But here the same procedure is performed in 2 major coronary arteries. If it is performed in 2 major coronary arteries, 92924 into 2 times. How many of you coded like this? 92924 into 2 times? No one in the class? I already told you 92925 is used only for branches, not for major coronary arteries. Understood now the rule? Yes sir?
Yes, sir.
Next, take one more question. And angioplasty procedure is
Sir,
performed.
1 minute, sir. In
Sorry, yes.
92925,
92925.
each additional branch of a major coronary artery.
Yes,
Okay.
we need to code only for a branch of a coronary artery. But here I said 2 major coronary arteries. The given question.
Yes, sir.
Understood. Add-on code is used
So,
only for branches.
only for branch. Okay, sir.
Okay. Now, next question. Angioplasty is performed in diagonal. This is the question given for you. Angioplasty is performed in diagonal. Angioplasty is performed in diagonal. Send me your code. That
92920.
92920. Everyone. Why? Because 92921 is an add-on code. I know diagonal is a branch, but 92921 is an add-on code. But if you read the code description of 92920, major coronary artery or a branch. If only the procedure is performed in only branch, 92920. Read the code description, everyone. The correct answer is 92920. Now understood the 4 rules I discussed? In a major coronary artery and its branch, in 2 major coronary arteries, only in branch, like this is the combinations they may ask you in the examination. I hope so everyone understood. Understood everyone? Any questions in PTCA? Any questions in PTCA? You need to know like that what is a major coronary and what is a branch. I already make you mark the paragraph which are coronary arteries and what are branches. Please go through it. Next come to ECG. ECG. Try to mark in your textbook itself. 93000 code, page number 728. 93000 code is used only for physician office. ECG code 93000 is used only for physician office. Nine three triple zero code is used only for physician office. Next 93005, 93010 other than physician office. Nine three 005, 93010 is used for other than physician office. Other than physician office. Next, 93015 code is that is a stress test used only for physician office. 93015 is stress test used only for physician office. ECG is included in 93015. ECG is included in 93015. ECG is included in 93015. Nine three zero one six to 93018 other than physician office. Other than physician office. Other than physician office. Can you see question number 1 and give me the answer? Question number 1. Question number 1. What is your answer?
93010.
Everyone the same answer. Any other answers? Any other answers? Question number 14. 93010 is your answer, everyone. Interpretation report. Now, question number 14.
Sir,
Yes.
sir,
Yes.
in question number 1, here not mentioned in physician office or other than physician office. How we can recognize it?
If it is mentioned in physician office, only you can use. Otherwise, if it is not mentioned in physician, the name physician office means you need to consider by default it as other than physician office. They will clearly document the service is provided in physician office. If it is not that scenario, then you can consider it as other than physician office. Okay.
Okay, sir.
Question number 14. completed? 14th question. What will be your answers?
9301526.
Micah. See, clearly they are stating it is performed in hospital.
Sir, but the cardiologist supervised the study and interpreted the test is there in last line.
It is in option C. If the service is provided by the physician in his office, then you can use 93015. And if you are coding 93015, we cannot use 26 modifier. We cannot use 26 modifier if a service is provided in physician office. Is there any physician office? Is there in the documentation? No. Hospital. Other than physician office, they perform. Now what this physician is doing? He is supervising the study and interpreting the result. Why? Because he is not performing. If he is performing and he is doing, then 93015. Understood? See, a patient is with you. You are a physician. You are having your own office. What you are doing? You are performing the test. Then 93015. Someone is performing the test, not you in your office. You are just monitoring the test. Or you are interpreting the report what he performed. That's a professional service. 93016, 93018. C is the answer. Understood, everyone? Understood, everyone, the scenario? Yes, sir.
Yes, sir.
Already we have seen in radiology 26 modifier related. Did we discuss regarding 26 or not in radiology? No? 26 related information did we discuss or not?
Discuss it, sir.
Clearly, 26 modifier do not use for physician offices. Okay. Make heading cardiac catheterization. Cardiac catheterization. First point, write down. First point, disease condition. What we need to look for? Disease condition. In that A, congenital cardiac condition. Congenital cardiac condition. Second one, acquired cardiac condition. Congenital cardiac condition. Second one, acquired condition. Next point. Physician examined only chambers of a heart. Only chambers of a heart. Physician examined only chambers of a heart. Next point. Or physician examined coronary arteries along with chambers. Coronary arteries along with chambers. Coronary arteries along with chambers. What are the three key points we need to look for? First, disease condition. Next point, only chambers or arteries along with chambers. Understood? These are the 3 points we need to look for. Can you see the code description 9345? First, I will show you. If the physician is performing cardiac catheterization for congenital anomalies, see the codes in your book. 93530, 743 page number. 743 page number. 93530, 93530 to 93533. 93530 to 93533. Nine three five three zero two 93533. Can you see those code descriptions that is used for congenital cardiac catheterization? Next one. If it is acquired, then the code starts from 93451. 93451. Can you see the code description? Only right heart. Just write on there right heart. Only right heart chambers they have examined. 93452 left heart. 93453 both right and left heart. Only chambers. 93454 only coronary arteries. Only coronary arteries they examine. Just write down there coronary arteries. 93456 right heart plus coronary arteries. That means they examine coronary arteries on the right side of the heart. Right side plus coronary arteries. 93457 93457 right heart plus coronary arteries plus bypass graft. Right heart plus coronary arteries plus bypass graft. Now, what we need to look for in the question is 2 points always keep in mind. One is the disease condition. Second point is coronary arteries examined by the physician or not? If there is no coronary arteries examined, then it is right heart or left heart. Always keep in mind what are the two parameters we need to look for. First one is disease condition. Second one is coronary artery. Now try to see the question. Question number 50. Question number 50. 50. If you complete first point, when you are reading a question, are you finding any congenital disease condition? Try to see those 2 points. Are you finding any congenital condition? Congenital heart condition in the scenario? Question number 50.
No,
No.
no, sir.
Then second point, is there any coronary arteries related documentation? Is there coronary angiogram like that? The given question, is there any coronary arteries related documentation?
Yes, sir. Coronary
Yes.
angiography.
Angiogram is there. Then when you are finding the coronary angiogram, on which side they examine?
Left side.
Left side, not
Left heart.
easy for you to quote.
Left heart.
With 93452, 93452 code says only left heart catheterization, not coronary angiogram. Yes or no? Rule out that option. Then 93453. When you go with 93453, it is combined right heart and left heart. Then rule out that option. Then 93458. 93458. How I can read 93458 code description? It is left heart, but it is an incomplete code. Then from where I need to read? I need to read from catheter placement in coronary arteries for coronary angiogram, including intra-procedural injections for coronary angiography, including supervision and interpretation. Then I will continue this one with left heart catheterization.
Including intraprocedural injections for
Procedural.
left ventriculography.
This is the procedure done by the physician. Yes or no?
Yes, sir.
Now this is the answer. It is very easy. Only 2 points you need to keep in mind. Is there any congenital cardiac condition documented or not? No. Then is there any coronary angiogram documented or not? Yes means you can quote the under appropriate catheterization under coronary angiography. If no means then you can quote under appropriate heart catheterization. Now you can check what are the syllabus left for you in medicine. The topics I said. I just read those topics what I said.
Immunoglobulin, serum recombinant products,
That we completed. Right?
vaccination, immunization.
That
Yes, sir.
okay, next one.
Completed. Moderate conscious sedation is also left. Over.
Okay. Yes, sure.
Sir, sonography is only not told.
Somnography is left.
Somnography.
Okay.
Yeah.
Yes, sir.
Sleep studies. Just see that scenario. 5-minute session.
Okay.
Somnography means sleep studies. Go with the code series. You can search where you are finding sleep studies. Did you find sleep studies? Page number 765. Page number 765. Page number 765. Are you there, everyone? 765.
Yes, sir. Sleep medicine and testing.
There you can see in page number 766. Polysomnography is there. Polysomnography.
Yes, sir.
Okay. Try to underline that parameters included. What are the parameters they are going to test in polysomnography? ECG, nasal or oral airflow, respiratory effort, oxyhemoglobin saturation, EMG. Now try to see the codes. 95808. You will understand. 95808. Polysomnography, any age, sleep staging with 1 to 3 additional parameters means the parameters what I marked there is ECG, nasal airflow, oxygen saturation. In that any three must be documented. 95808. 95810 is it's an age related polysomnography, age 6 years or older. That means greater than 6 years. Greater than 6 years. Greater than 6 years with 4 or more additional parameters. 95811 means age 6 years or older. These two are age related codes. One is less than 6 years, one is greater than 6 years only, both are. But there are 4 additional parameters. The difference here is one is attained by only technologists. In 95811, along with this one, they are also performing CPAP studies, continuous positive air pressure therapy. Continuous positive air pressure therapy, CPAP. 95782 783, age related again, less than 6 years. Try to mark those codes. Understood? Polysomnography, age is the factor. Then you can see CPAP is performed or not. And this is all about medicine section. I completed for you E&M, anesthesia, radiology, pathology, medicine. The only topic left for your course is surgery section and HCPCS. Surgery and HCPCS. Surgery, by tomorrow we are going to start with surgery. Everyone please go through the anatomy of eye, ear and nervous system. Tomorrow we are going to start with 60,000 studies. In the same way what I said, the paper is changed for case studies. It's already there. I will show you what is the meaning of case studies. Now as I said, how many hours the examination is? How many hours?
4 hours.
4 hours. 100 questions. 100 questions, 4 hours. I will show you what are the case studies they are asking in the examination is. Already it is in our practice papers. Along with your surgery topics, I will make you prepare at least 3 to 4 questions. You can see here. This is the questions they are asking in the examination. Already it is in your papers. You can see example question number 36. Integumentary paper. If you are having integumentary paper, take out that paper. Question number 36. Pre-operative, post-operative, indication for surgery, description of surgery, and they will provide options A, B, C, D. They will provide multiple choice. Understood everyone? This is one case study. They are telling it as case study, but always we are practicing from the day one this type of questions. Question number 37 again. This is another case study. 38, another case study. 41, another case study as per their documentation. Understood? These are nothing but case studies. This we can do easily, not an issue. Tomorrow what you will prepare before coming to the class? Which anatomy you will go through? What are the topics?
I
Eye
ear,
and nervous system. Yes or no? We will complete tomorrow 60,000 syllabus. Hardly.
pain and muscle.
sir, what are the
Yes.
sir? What are the conditions we should not code in ICD, sir? Suspected, probably, likely, rolled out, inconsistent. Also, we can't code.
Anything which is not
Yes, sir, we
confirmed by
can.
the physician, we cannot quote in outpatient. Any uncertainty, any uncertainty diagnosis, we cannot quote in outpatient. Those are the uncertainty verbiage, like probable, questionable. Understood? Sure.
Okay.
See here, everyone. See, I am off for Pongal holidays. 13, 14, 15, 16, 4 days. The classes will be resumed for you on 17. So that from tomorrow onwards, these 3 days, I will take a little bit half an hour extra for you. 7 to 9. Understood, everyone? And the syllabus will be completed for you by 23rd. 23 of this month. The total syllabus, the total course will be completed for your batch. Okay. After that, I will discuss on the same day how to write a mock examination. The people who are willing to take the examination, you can prepare those mock papers, what the admin person is going to share you as the updated papers. I hope so understood everyone. 13, 14, 15. 15, 16 is Saturday, Sunday. 13, 14, Pongal holidays. I am taking Pongal. Understood everyone? No questions. No questions. No questions from your end. Now tell me, are you practicing on a daily basis those questions or not? The papers you are having 40-40 or 50-50, that individual papers you are practicing or not? No?
Practicing, sir.
Okay.
In E&M, some things are remaining, no? Like for new patient and for office visits, some description for evaluation is changed, no, from earlier. So I think
Yes,
like that
the
series
case studies
201.
regarding E&M, I will take one class.
We will cover that.
You are getting
Okay.
case studies examination. That I need to take one more class for you regarding to teach MDM and everything. That I left there. As per the changed concept. Otherwise, I completed the syllabus. What you can do for multiple choice. Regarding E&M case studies, I will take one more class for you. Okay. Other than nothing will be left there.
So Mohan, how many questions pattern as per case studies will be there in the exam? New test paper?
10 case studies. Case studies is nothing but options is there A, B, C, D as I shown you right now, or you can see in your paper also. Pre-operative, post-operative or level evaluation in E&M. Okay. It is easy compared to the previous paper, 150 questions. 100 questions, just you need to get only 70. 30 questions are there buffer with you. And the time is also 4 hours only that we can focus. 5.5 hours means a person is sitting 5.5 hours is getting difficult for them. 4 hours is an easy to sit and you can concentrate and you can easily write down. Okay. Anyway, after
But Mohan, in this case, you have to read all the paragraph, na, everything. So if any tricks are there, like to quickly reach the code.
There are some tricks that I will show you. And how we can complete within 4 hours means 240 minutes. 100 by 240 minutes means how many minutes per question? 2.5 minutes, right?
Hmm.
In 2.5
Sir, 2 minutes. 2 minutes 40 seconds.
that means 2.5 for something. Okay. 2 minutes
2.5,
40
yes.
seconds is there. In 2 minutes 40 seconds, how we can see a report? Then I will show you some tips for you. No issues.
Hmm.
Okay.
Okay.
This week and next week I will complete the theory part, but every Saturday, sorry, not every Saturday, every Sunday you are having a doubts discussion session.
Hmm.
Every Sunday you will have a doubts discussion session. Don't worry. Okay. In that I will cover all your
Okay.
doubts. Thank you.
Okay. Sure. Thank you.
So it means